The world is hurting right now, and it's time to rise up. As we lift ourselves up in body, mind, and spirit, we can reach out to others and be a light in a sea of darkness. Welcome to the Movement for Global Health with your host, Dr. Mary Zennett.
Dr. James Granger, MD, is a medical doctor in practice for over 20 years. He is the author of We Have It All Wrong, Our Failed Sick Care System. In his book, he talks about various topics affecting health and politics. His practice is the only licensed pain clinic in Georgia to feature acupuncture as a means for treating chronic pain. Well, he has so much to teach us. He does treat opiate addiction with medically assisted therapy in his office as well. Well, Dr. Granger, thank you so much for being here.
Thanks for having me.
And it's a critical time in medicine. And maybe you could just talk for a minute about what you mean about this. Our failed sick care system.
Well, our system is reactionary. In other words, it's based almost solely on allopathic medicine, which is give you a pharmaceutical or do surgery after a problem arises rather than prevention. I like to quote the figure when I entered medical school years ago. There were only 4 medical schools in the US that had a designated course on nutrition. And I went to one of those schools, and the course on nutrition had essentially no clinical applications. It was basically DEKA, or your fat soluble vitamins, the end. So it was more like they were trying to check a box rather than give you something that could actually help your patients stay well and prevent disease rather than wait till after they had the disease and give them a pharmaceutical. So that's the big thing I think we've got wrong.
Yeah, it's upside down. Now, we've heard now they're going to introduce nutrition into medical education, which is great. But the question is, in what level of depth? Like what you're describing, there was no depth.
No, there wasn't depth, and I'm really skeptical about that as to what they mean by nutrition. For example, is nutrition, here's an orange for vitamin C, or take this IV full of synthetic vitamin C, because there's a difference there. I favor food, which is a whole nother topic in itself, almost. And there are other things, there are lifestyle habits that aren't addressed. We can all think of smoking, alcohol, and that's why, treating people with acupuncture and other means besides opiates for pain control is a big part of my practice, because I tell people all the time, nobody's ever overdosed from acupuncture, but we have thousands of overdoses daily from opiate-based medication.
Right. So we're in an era of, it is truly an opiate epidemic. It's so, if you're in healthcare, I mean, it's really scary to see. And how many young people, and it's so available on the streets.
Yeah, one of the things I do in my practice is medically assisted therapy, which a lot of people will be familiar with. Suboxone as kind of the trade name for buprenorphine that we use to treat opiate addiction. And years ago, I would have to induct the patients into the Suboxone or buprenorphine medication. But now, and for the past several years, they come into my office and they've already been taking it off the street, but they've made the decision, I want to do this the right way under medical supervision, which is kind of a double-edged sword. On one half, I don't want to see them using it on the street. On the other hand, it got them into my office for help. So that's a big problem. And the other problem, and I'm only speaking of my practice, is the majority, and we're talking well over 90% of patients that come in, they're coming in as a self-referral. They're not being referred by their primary care or another physician. So I have issues with that as well. I don't think we, as a medical community, are addressing the problem not nearly as what we need to be.
So what you're recommending is should be a whole team approach. The specialist, the primary care, and you're technically a primary care internist.
Well, I don't do primary care in my office. I have three aspects. It's the medical assisted therapy, pain management, and acupuncture. And there's a lot of overlap between those because I'm trying to take my pain management patients and introduce them and say, look, here's something you can try and maybe should have tried before you got, kind of down that dead end street of opiate-based medications. And, I'm always happy when I can get somebody switched away from opiates on acupuncture, or at least mitigate their opiate use with acupuncture. Or, sometimes my medically assisted therapy patients, they ran into opiate problem because of a pain condition. So if I can treat their pain with acupuncture and then, even get them off of the medically assisted therapy, I count that as a success. But if I can have them not run into the behavioral component of addiction and just be opiate dependent, that's also some degree of success.
Oh, that's now tell us more about your patients who are able to come off opiates altogether with the assistance of the acupuncture. This is just amazing. It's remarkable.
Yeah, it really comes down to patient commitment. And sometimes it's really difficult because if you've got somebody that's been using opiates for 10 or 20 years, it's going to take some time before you see the benefits of that acupuncture. And then when you talk about that commitment, there's also a financial obligation because a lot of times insurance won't cover acupuncture, which is another hurdle I have to go through. Medicare just recently decided to only cover acupuncture for low back pain, but there are other, plethora of painful conditions that could be treated with acupuncture. So what I see more and more is people who have been on the pain medication, they've run into trouble, they want to get off the pain medication, so they're looking for something else for their pain, and that's where acupuncture comes in. And then, of course, I do have, a smaller number of patients who have gotten off of completely, which I said, that's always a great success to see.
That's incredible. But again, you speak to the financial issues. It's like it's upside down, and we need more non-pharmaceutical proven modalities. We need them available for people.
Yeah, and one thing that sticks in my mind is about a year or two ago, I was doing an online CME course, and I think it was through Harvard or, one of the Ivy League schools up north. And they had this kind of video depiction of a practitioner talking to one of his patients saying, oh, you've kind of failed the opiate trial, but I know somebody who does acupuncture. And I sat there watching that thinking, why didn't you send them to the acupuncturist first?
Thank you.
And that's where, I see the problem in our healthcare system. As I said a few minutes ago, nobody's ever overdosed from acupuncture.
Exactly.
I was taught to do least invasive first.
Absolutely. And I'll be honest with you, I sung this song of health reform for a long time. And I used to say, the system is upside down and we need to turn it right side up. The problem is all the barriers, financial being one of them, the big one. The financial barriers are huge.
Yeah, and you don't see, medical societies and organizations, what have you, advocating for, why can't I get my patient an epidural? Why can't I get acupuncture for my patient? Why can't I get physical therapy for my patient?
Mhm.
I see it all the time as a general practitioner, family practice. They'll write, a tramadol or a low dose opiate. And then as soon as a patient says, this isn't working, I need more, then they send them to pain management.
Mhm.
Pain management might be able to do an epidural or two, can't get it covered. So then they end up on opiates, and acupuncture, chiropractic get left out of the picture.
Exactly. Exactly. I don't know. Are you seeing more and more, they talk about this opiate crisis. I see it and I'm a psychiatrist. I mean, I see it. And these are young people. It's like, my God, all this on the streets that they're getting. I don't know. I don't want to think that my population is skewed. Are you seeing the rates rise?
It's hard to say as far as the rates rise. But the past 2 or 3 months, I've seen more people coming into my office for medically assisted therapy. Now,
Wow.
that's part of that may be my advertising for the practice has really been focused on that as of late. So that may be part of it. But one thing I do see that a lot of people aren't aware of, it's just not young people. I have Medicare elderly people who, have addiction problems. And I'm not talking about dependent on opiates for back pain, they've had previous surgery.
Right.
We're talking about addictive behavior, which you see a lot in psychiatry. And people need to make that distinction as well. There's, people who are opiate dependent, and granted, there is a population that their condition is going to warrant opiates, but we've also got to be aware of the addictive behavior. And I don't see a lot of primary care physicians even screening for that. Because I ask my patients when they first come in, how did you originally get started with opiates? And there's the patients that got started because they were recreational use, and then there's some that started because they had a pain condition, car accident, dental procedure, and then the third group is a combination of those. So we really, as a profession, need to be more focused on screening for this. And then from the insurance side, we really need to open up other modalities so that people will have access to other options that don't get them down the road to addiction.
Absolutely. And you've been at this for a while. You're doing a phenomenal job. And I know I commend you, and I read reviews from your patients. Your patients commend you. They said, you don't sugarcoat it, but you're very empathic. You care about the patients, and you don't want them any more addicted than they already are.
Yeah, that's where I talk about sometimes you have to look at just mitigating their use as a success to some degree. I've had a large number of medically assisted therapy patients who, once I got them on the therapy, their life changes. They go from being nearly homeless to now they have a job, they have a family. And then it gets tricky after that, because then you got to decide, okay, when's a good time to get them off of this?
Right.
And the way I describe it to patients, it's, it's safer to walk downstairs than to run downstairs. So it's a slow process, and we have plateaus. Sometimes they'll have a life event, a divorce, a death in the family, where, okay, maybe not's the best time to put that burden on weaning down off your medication. Let's just stop here for a moment, talk about these other things, and then continue to go down on a later date. And another big thing, and this goes to your aspect, is I tell them all the time, the counseling and the behavioral changes and identifying triggers and learning and developing coping mechanisms is the big part, because, relapse is part of the picture as well.
Right.
It's, again, bittersweet when a patient comes back saying, I need your help again. I'm glad that they come back and trust me to come back, but at the same time, you would rather him not need that particular service again.
Exactly. But that they reach out and come back is to your credit, that they trust you. They trust you enough. It's like, and part of recovery is, hey, I made a mistake. I messed up.
Yeah, I describe it as a speed bump.
Exactly. And you welcome them with, open arms and, okay, let's get back on track again. In your practice, do you address nutritional? You mentioned nutritional, because I noticed some of the things you had talked about was the impact of food additives and GMOs. What impact do these have on our patients?
It has such a wide impact on the population as a whole. With the foods we eat.
Yes.
Just to kind of keep it brief, what I generally tell my patients is avoid the white stuff, which is sugar, dairy, white flour, and illicit drugs. If you picture cocaine in your mind, all those things are either addictive or inflammatory. So that's kind of my 10-second spiel to, all my patients at some point. And some of it is very simple, just assessing their lifestyle. For example, I had a gentleman in a couple of weeks ago complaining about sleep. So my first question is, how much coffee do you drink? Well, he's drinking coffee out until 4 p.m. And it's like, well, if you look at the half-life of caffeine, that's why you can't get any sleep. So that's our first intervention there. And then you pile on the energy drinks, which are caffeinated. You've got things like aspartame and sucralose, which are neurotoxic, excitatory.
Right.
I try to get people to stay away from the artificial sweeteners. We can talk about GMOs, but then that gets into the financial aspect of things. Somebody who's on a fixed income, they can't afford organic food so much. And another thing I tell people is water is your best friend. Stay away from sodas. It's basically a liquid candy bar. So those are things that I try to cover with everybody just in general. And of course, my book is out there for people to read. I'm working on the second edition because a lot has changed since I originally wrote that book. I wrote that book actually before I added acupuncture to my practice, which was before COVID came about. So there's that as well. So I've got a lot to add in for the second edition.
Is it going to be the same title?
Yeah, I'm going to keep the same title. It's just there's going to be a few more chapters, and in the book there are a lot of web links so that you can access where I got the information from, and some of those links have expired, so I've got to update those. And of course, there's new information that kind of backs up what I was saying 10 years ago, so I've got to add that in as well.
Well, that's great. And for our listeners, what is your website?
It's acupunctureandinjury.com.
Okay.
It's my office website. And for the book, we have got it all wrong, our failed sick care system. I have a page on Facebook where, intermittently I'll post up some things that I feel are informative and in line with what I have in the book.
Well, that's wonderful. And what we can do for our show notes, we can include those links. So you have a Facebook page. We've got it all wrong.
Yes, we've got it all wrong, our failed sick care system.
Beautiful, beautiful. It's terrible to admit, but it's such a step in the right direction when you shine that light on this and help empower people So it's like that they can get their health back, but they've got to be proactive.
Yeah, and one thing I'm going to talk about in the book as well is functional medicine.
Beautiful.
Because functional medicine, it's kind of a different version of allopathic medicine, so to speak. You're still doing lab work and that type of thing, but the drawback to functional medicine, I say drawback in quotes, is that it requires a lot of work on the patient. It's not just here, take this pill. It's like you've got to make some lifestyle changes. We've got to identify some things and that sort of thing, but it can be proactive and not necessarily reactionary like typical allopathic medicine is.
Exactly. And I think it's a process. Like when you're working with your patients, you're educating, you're empowering, and the more they catch on, then the more they do. And then you follow up and you reinforce it with them. So it's important for our listeners, don't be discouraged. When you find a doctor that you can trust, like Dr. Granger, stick with him. Stick with the recommendations. And, small steps. All those small steps can have a big outcome.
Yeah, and that's something I run into is trying to get people to understand it's a process. If you've got dietary lifestyle habits that have been going on for years, you're not going to fix them like that overnight. And it's the same thing with acupuncture. People have this perception that I'm going to stick 5 needles in and magically everything goes away. No, it's a treatment process. I tell patients, a course of treatment is 10 visits, and depending on how long you've had your condition, it can be several courses of treatment. Now, there are times when, boom, pain's gone on the first visit. I have had that happen, but I under-promise, over-deliver is the way I describe it. By visit 5 or 6, you should be saying, oh, okay, I see something here. But 10 visits is a course of treatment, and that requires some patience. Because coming to see me 2 or 3 times a week for the first couple of weeks, I know can be time consuming, but at the same time, people do the same thing with physical therapy, with chiropractic, but their expectations are a little different for whatever reason.
But it's a reminder to stick with it. Stick with it. It's not, just a one session, magic, but it is what's going on in the body is magic. It's just that it takes some time.
Absolutely. I look at it, the body will heal itself. You just have to help it. So kind of a graphic image I give is, when you have a cut or an injury and we suture it or put a bandage on there, that suture and that bandage is not doing the healing. The body's doing the healing. That suture and bandage is aiding in the healing and preventing infection, but the body is healing. So we have to help that healing.
Yeah, this is wonderful.
And it's a process.
Exactly. It's a process. It takes time. The nerves, the muscles, the cells, everything, the whole body, and the mindset. The mindset, because when you're in suffering, it's so painful. It's hard to, but as you feel better, the mindset, it's better to get a handle on it. It's not so overwhelming.
Yeah, and I see patients all the time. Some will come in, oh, I just want to try this and see if it works. Well, you've already got some doubt in your mind and that works against you. And then I have other patients who come in and say, I know this is going to work. The healing's going to be better. I'm committed. And in general, they do better.
Yeah, that's awesome. That's awesome. Well, this has been wonderful, Dr. Granger. I want to thank you so much for everything you're doing. And we will have the links in the show notes to your book. And we look forward to your second edition with all these updates.
Thank you.
And then your Facebook page. Are there any final words for our audience?
I think we've covered a lot of things. I would just say that, understand that help is out there. If you've got a problem with addiction, there are other means to treat pain other than just taking a pill. Don't dismiss acupuncture, chiropractic, physical therapy. And sometimes you may have to reach into your wallet for what your insurance won't cover if you really want to get healthy. I know some people don't have the means for that, but just know that, there are, as Mr. Spock always said, there's always alternatives.
Well, thank you so much, because you are on the cutting edge, helping people. And it's, again, this opiate crisis is a crisis.
Oh, yes.
It's worldwide, and here in the US, it's like you say, and it's people oftentimes, it starts with a prescribed medicine. It's like an injury, but then it takes a life of its own.
That happens far too often. And as you mentioned that, I just thought of one other thing is it really bothers me when people stereotype the opiate user. I can tell you, I've seen people with addiction problems from all professions, young kids going into college, attorneys about to take a bar exam, truck drivers, housewives, cooks, waiters, waitresses, construction workers, other health professionals. It's not just, the homeless person on the street. There are people that you're seeing every day that have an opiate problem that you just may not know about. And that goes back to what I was saying about primary care physicians need to do more screening.
Yeah, the hope is at some point this education, like what you're doing, is going to reach the primary cares, and they need to be given the time too, to take the time with the patients. But for our listeners, if you know of somebody that is struggling with opiates, Ed, who of us doesn't have a friend or a family member, a co-worker that's struggling in some capacity, please direct them to Dr. Granger's, his book, the website, and word of mouth, get the word out. There is hope.
There is. There's always alternatives, and there's help out there.
Awesome. All right. Well, once again, thank you so much, Dr. Granger. We really appreciate your work.
All right. Thank you.
All right, then. Bye-bye.
Bye-bye.